Stress is one of those things where whenever we think about it, we consider it something negative. But hopefully today you'll see a little bit that stress actually is important. And it must be important because it's been developing for 4 billion years in ourselves, long before we had a frontal lobe and the kind of things that we're going to discuss and tools we're going to give you today to deal with stress. So we wanted for today to not be a lecture. We really wanted today for this to give you actual tools. Stress is out there, every one of us has it. It's not going away. So we wanted to give you tangible things that we could let you leave here with, things that I can promise you that I use almost every day. If you leave the Health Science Center at 5 in traffic, you'll understand. So introduction, so Beth was nice enough to introduce me. Let me introduce two other people. One is Dr. Courand Neely. Courand we hired about a year ago. She is one of our behavioral health providers for our residents and trainees. So we now have a program where all of our residents and trainees have free, convenient counseling and a program that identifies residents at risk. So Dr. Neely is our primary counselor and the person that manages the interactive screening program for trainees. Because she was so awesome last time and we wanted to tip the scales of awesome in our favor, we also invited Dr. Tom to come back. Dr. Tom, as you know, is an assistant professor of pediatrics. She's a course director for one of the MS4 rotations and a faculty advisor, and she gave an outstanding talk last time on time management, so we figured we would invite her back and it would all be good. So literally I have 2 slides and then I will turn it over to Dr. Neely. I give this to our residents and fellows when I talk to them about wellness. And what I say is that we all have in our lives, be it individually or at work, stressors, and that's natural. And it would be impossible to address all of these today, but what we really want to do is to identify the things in individuals that we can do to help deal with the stress that will naturally come your way. So we're going to talk a little bit about identifying stress and stressors. We're going to talk a little bit about positive psychology and a tool that you can use to help you enhance that in yourselves. And then we're going to do a brief mindfulness exercise. Okay? And those are the things that we're going to do today. So this is how it's going to work. So there are 3 groups. You have these tables in the front. You're the blue group. I know that little sticker didn't look blue, but you're the blue group. Back here, we have the yellow group. Okay, that's Dr. Tom's group. And over here, these 4 tables, is the pink group, and that's Dr. Neely's group. When you're with Dr. Tom and Dr. Neely, you're not going to move. You're just going to stay where you are. Okay? When you're with me, like the blue group initially, we're actually going to leave this room and we're going to go across the hall to 305. That is a smaller, quieter room where we can do some mindfulness stuff. It's impossible to do it in a big room like this when other people are talking. So when we start after Dr. Neely's talk, I'm going to grab the blue team and we're going to go next door. And then individually, about every 15 minutes, we're going to switch and I'll grab a team to go, and Dr. Neely and Dr. Tom know what they're going to do. Okay, so once you come out of 305 and go back to your place, you will not need to move again. Okay? Does that make sense? Everybody confused? Great. Added to your stress. Perfect. Okay. Now I'm going to turn it over to Dr. Neely.
Good afternoon, everybody. So I have a quick question for you. In the last couple of weeks, have you had an opportunity to come home from work, sit on your couch, and feel exactly like this beautiful little dog right here feels? Raise your hand if you've had that experience, where you've come home from work, you have sat on your couch, and you've said, oh my gosh, today has been rough. Just like Dr. And so if you look around, I think almost everyone has their hand up. And so just as Dr. Courand said, stress is universal. We all have it, whether you're old, whether you're young, we can't avoid it. What we're really trying to do is figure out, how do you mitigate it? How do you control it better? Because getting rid of it is really not an option. And so that's really what I want to spend a few minutes talking about. And so the first thing when you think about stress, typically we kind of go, you know what, oh my gosh, I'm so stressed out. But we never stop to think that stress really develops in a predictable cycle. And anytime you think about cycles, if there's a cycle, then you can disrupt a cycle. So stress usually starts with a precipitating event. We're in San Antonio, so I'll say I'm driving on I-10 and somebody totally cuts me off, my event. Typically what happens after that event is that you start to have an internal dialogue with yourself. You start to have this conversation. Oh my gosh, I can't believe he just cut me off. This is crazy. I could have got killed. What was he thinking? And so we really kind of rev ourselves up in this internal dialogue. Soon after that internal dialogue, we kind of move around this cycle, and then we either go into fight or flight mode. And so for a lot of people, fight mode is, I'm gonna honk on my horn really, really loud. I'm gonna let him know I'm here. Unfortunately for some people, and I'm sure nobody in this room, follows the person, pulls up next to them, and all the road rage incidents that we see. And then coming along that cycle, we see that our nervous system gets involved. So our heart rate goes up, all of our stress hormones kind of come into play. The reason I wanted to point this out is that if you are slowing down enough to be aware of that, then you can disrupt the cycle. You can't change the precipitating event because things are going to happen to us, but what we can do is to disrupt it right at that internal dialogue, right when we start having that conversation where we're really revving ourselves up. So next, as we think about stress, we think about it in terms of being acute and chronic. So acute stress is, I have a presentation today and I'm in front of a room full of people. I may be feeling a little stressed. I signed up for a marathon and I did not train for it. A little bit of acute stress definitely happening there. So we know that acute stress happens, it starts, it stops. What is more interesting though is chronic stress. And so if you think about the stress that you have on a daily basis, the drive to work, an annoying boss, bad work schedule, difficult spouse, poor sleep habits, negative thoughts, those are the type of stress that if it stays and it's prolonged, that it really starts to lead to some medical problems. And so we really want to look at how do we mitigate that chronic stress? How do we control it a little bit better? So let's take a look at some warning signs. And I'm not going to read all of these, but what I want you to do is this for me. They're broken up into 4 sections: cognitive, physical, emotional, and behavioral. I want you to ask yourself a question. How does my stress show up? Does it show up more cognitive and emotional? Is it more in that physical realm? Is it more behavioral? With the idea, once again, that if you are aware of something, if you're mindful, if you slow yourself down enough, then you have a chance to do something different. So, cognitive, physical, emotional, and behavioral. We know that stress is present. We have to have it. It's going to be here. But one of the things that is really important is the fact that ultimately, when you allow chronic stress to continue, it can really lead to some serious medical problems in terms of brain and your nerves, your heart, your stomach, your pancreas, increased risk of diabetes, reproductive system. And so stress is something we really want to control. We don't want to act like, oh my gosh, we all have it, that's what it is. We want to figure out how do we mitigate it. Not necessarily get rid of it because we need a little bit of it, but how do we mitigate it? And so there are benefits to stress, definitely benefits to stress. And so if you look at this stress performance curve, if you look at the green section of the curve, that's when you have a little bit too little stress. And so we know that when that's present, we're inactive, we're lethargic, we're not really getting a lot done. But we definitely don't want to be on that red end either. We don't want to be where it's burnout, where there's fatigue, where there's breakdown. And so looking at this, the sweet spot is really in that yellow area, optimum stress, just enough to where I have that pressure on me, to where I can be successful, but not to the point of fatigue. So once again, kind of self-assessing, slowing down and thinking about, okay, where's my stress right now? If you had to identify what zone am I in? Am I in green? Am I in yellow? And if I'm in yellow, how do I become aware of when it turns into fatigue? Because that's what I want to mitigate. I want to back off of the fatigue because then I slip into on the other end where I'm going towards the burnout and towards the anxiety and the panic. So that's the end of my slides, and I think now we're going to break into our groups. Dr. Courand? Okay.